today, and we held a COVID and Economic Recovery Committee earlier this morning. Today I'm joined by the Health Minister, Brad Hazzard, our Chief Health Officer, Dr Kerry Chan, and the Acting Commissioner of New South Wales Ambulance, David Dutton. Firstly, can I begin by thanking our frontline health workers right across the state who have done an amazing job over the last 2 years, and particularly going through this most recent period of time with significant vaccination and now booster shots required. I really want to thank you on behalf of the government, on behalf of the people of our great state, for the continued effort you make in keeping our people safe as we move through this pandemic. If you look at the booster shots, they are incredibly pleasing numbers, and I want to thank the people of New South Wales who have gone out. If it's been 5 months since your second vaccination, the booster shot is key to keeping you and your family safe. And to see now that Health has administered 158,000 booster shots as of the 22nd of December is incredibly pleasing. I want to particularly thank our GPs and pharmacists who are also carrying out those booster shots. I congratulate the Prime Minister and the Federal Treasurer for their decision yesterday to provide additional financial support for our GPs and pharmacists who will be taking a heavier load when it comes to the booster shots over this period of time, particularly over the next 4 months. But to everybody right across our state, can I please say, if it has been 5 months since your last vaccination, please go out, receive that booster shot. We have 40 centres, 40 vaccination centres across our state, 100 mobile centres as well, and we will be getting to around, from the New South Wales government's perspective, around 300,000 booster shots per week as we head into the third week of January. So that will be crucial. It's our best line of defence as we move through this next phase of the pandemic. So I want to thank everybody who has gone out and made the effort. I know we're heading into the holiday season, but please don't let your booster shot be part of that holiday. Please go out and get that shot and make an appointment where you can. The other point I'd make today, which came through National Cabinet yesterday, which the early signs are very pleasing, and from the advice that we received from the Chief Health Officer, Dr Kerry Chan, this morning, is that we're seeing it looks like that Omicron will be 5 times less severe than Delta. So those early signs are very pleasing, but obviously we need a bit more data and a bit more time as we move through. We do know here in our state, the majority of people who are contracting the virus at the moment are generally younger people. So we'll keep monitoring that situation as we move through this phase. But I want to particularly note that the early signs here, the early signs are encouraging. And I note the Queensland Chief Health Officer's comments this morning in relation to Omicron, and I think as a nation we're seeing that as we move through this next period of time. We've always said as we've moved through this that we will monitor the situation and the evidence in front of us. The key indicators to us are not the case numbers, but rather ICU numbers, hospitalisations, and in addition to that, importantly, the ability of our healthcare workers here in our state to provide the care that people need if they're seriously ill as they come into the hospital system. What we're seeing at the moment is that many of our health workers, around 1,500 just today, are either sick or unable through testing requirements to be able to come into work. We need to ensure that as we move through this next difficult period, that support and care is there. So this morning we made a number of changes over this period of time, and I'll quickly run through those now. As of midnight tonight, we will be requiring that masks are worn in indoor settings. We are encouraging people, particularly over the holiday period, if you can work from home, please work from home. We do want to limit mobility just as we get through this period of time, and particularly in relation to ensuring that our health workers are able to be on the job and provide that care and support for those who are unwell. We'll be moving from for hospitality venues indoors to 2 square metres from December 27 to January 27, and also that indoor face mask requirement will also be in place until January 27 as well. So December 27 in relation to 2 square metres, and that's just to ensure that as we move through this period of time, we do have that support for our health officers over this summer and holiday period. In addition to that, we're also encouraging people not to mingle, and when you're out at a restaurant, you're out at a cafe, you're out at a pub or a club, please, where possible, don't mingle. We know that from the case that we've seen in Newcastle that singing and dancing and the like has been part of that increase in spread. So we just ask everybody, use personal responsibility. Please be cautious as we move through this phase. The other aspect arising out of National Cabinet yesterday was the national agreement to put in place QR codes. Many of you would be aware we've had those QR codes in place for some time. We kept them in place for high-risk settings. What we will do in relation to retail settings and lower-risk settings is we will bring them back in a limited way. The reason we removed those QR codes, I think, has been slightly misunderstood. It's not actually in terms of opening up the economy, it's to provide that support to the health system. And so Dr. Kerry Chan will provide a bit more advice in relation to that. But what I would say is that if you have been into a setting and you have checked in and you receive a notification from Service New South Wales that the number one position is that you monitor for symptoms, and if you do not feel unwell, you don't need to be tested. At the moment, what we're seeing is that many people across the state who are asymptomatic, who do not feel unwell, are lining up for a PCR test. This is putting enormous pressure on the system, and I thank everybody for their patience as we go through this period of time. But we need to make sure that those people who need to get tested in a timely way, and importantly, that we get the results back to people as quickly as possible. So if you aren't feeling unwell simply because you receive a notification through the QR code system, the position that we have here in New South Wales is monitor for symptoms. If you do feel unwell, at that point in time, please go and get a PCR test. But if you don't feel unwell, there is no need for that testing to occur. That will help alleviate some pressure on our testing centres right across the state. Obviously, I want to thank everybody who has gone out, close to 150,000 tests a day. The other point I'd make here is in relation to, and thank the other premiers around the country. There are obviously requirements in place at the moment, as the Health Minister labels it, the tourism testing. I want to thank particularly the Queensland Premier, Anastasia Palaszczuk, who's announced that she will remove that requirement and transition to a rapid antigen test from 1 January, because we're seeing, in respect of testing, around 20% of those tests that are occurring are for the requirement of interstate travel. That is putting substantial pressure, and I'll continue to work with premiers across the state to transition from that system of a PCR test to a rapid antigen test. That will reduce the lines, and what it particularly does, and I say this to the other state premiers around the country, what it does is it ensures that those people who need a test get a test, and importantly, we can get the results back as quickly as possible for those who are sick and unwell. So I thank everybody for their patience. I do know that there has been a fair bit of frustration out there. Many people waiting hours in queues, particularly as we come into Christmas. We're doing everything we can to alleviate that pressure. The two things we can do is move away from that interstate PCR testing. And in addition to that, if you're unwell, so for those people from New South Wales, if you aren't feeling unwell, please do not get a PCR test, because you're taking the place and extending the queue for someone who is unwell and sick at this time, and we need to get those tests back as quickly as possible. In addition, today we also made an announcement in relation to rapid antigen testing and providing free rapid antigen testing into next year for people right across our state. We see this as crucial as we move through this next part of the pandemic. We need to move away from PCR testing. We want to make sure that we drive personal responsibility, that we will play a role here, and I've tasked the Investment Minister Stuart Ayres, the Health Minister Brad Hazzard, and the Finance Minister Damien Tudorhope to work towards providing free rapid antigen testing for people right across our state. Now, this will help people in circumstances where you're going into a high-risk setting or you're visiting an elderly loved one, that in those circumstances, as we head into 2022, as we move into this next phase of the pandemic, you simply take a test at home, If it's a negative test, that will provide confidence in the system, and more importantly, confidence to you that you're COVID-free and being able to go out and visit your loved ones and visit high-risk settings as we move into next year.